Hi, I'm itinder Singh. I'm here to represent my book review on book Tell Me the Truth by Dr. Ranjana Srivastava. Now, the next slide is about an author who is working as an oncologist in Melbourne Hospital. She is a chemotherapist expert. She graduated from Monash University. She won the Fulbright Award at University of Chicago, which is regarding the ethical issues in medical practice. She gave her expert view in New England Journal of Medicine and The Lancet. She won the Cancer Council Victoria Arts Award and Gustav Noble Prize for outstanding academic writing and has published two books, Tell Me the Truth and Dying for a Chat. Now we start with the introduction. This book takes us on an emotional roller coaster as we read forward the personal journey of an author in day-to-day interaction with patients. It gives an inside view of doctor-patient relationship, an experience of the changed way of thinking and influence of it on the author's way of dealing with patients. It also highlights the family adjustments and difficulties authors face to cope with difficult situations. Now the next slide is about the purpose, why the book is being written. The book shows the struggle the doctor face in juggling the demands of practice and patient needs and call to humanity. It also highlights the ethical issues in informing the patients and relatives of the impending death and to bring forward the courage of people and their family in adjusting in the time set of life and death. Now the next slide is about the key points about the book. The first point is about the doctor's resistance in telling truth to the patients. As we notice in day-to-day medical practice, that the patients are being provided with incomplete information which hinders them in making the decisions about their treatment and put them in a dependence upon the physician for making choices about their treatment, and also to understand when to say that no further chemotherapy is effective other than the palliative care, and also there is a lack of open-ended questions in communication with patients which also affects the patient in making the choices about the treatment procedures and the further treatment in the future about them. The key points to be continued. For a doctor to comprehend that the patient leftover life is to be given emphasis and let patient enjoy life with family and close ones, thus telling them how long they have to live influence course of disease. The emotional and psychological aspects of patient needs are neglected in day-to-day medical practice. Now the recommendations as per the author. The treatment to be given should be ideal and compliant according to the needs of patient. Give patient choice of questioning and reveal truth. The most important thing to consider in decision making should be the will of the patient and not just the doctor's choices. And the practitioners should think according to the patient perspectives and not empower them. Now the next slide is about the critical analysis. There was one case in Canadian Supreme Court where a patient had filed the case against a surgeon who had developed stroke and was paralyzed after surgery, so he filed the case but lost it, and the statement being given by the judge of Supreme Court was that withholding the information was justified as he may be unable to cope with facts. Now the critical analysis to be continued. In case against the Beltham Royal Hospital, the case was dismissed when a neurosurgeon had failed to warn the patient of 1% risk of the spinal cord damage during the surgery which had really occurred. And according to the cops, The patient, being unlearned in medical sciences, has dependence upon and trust in his physician for information upon which he relies during the decision process, which highlights that in making the decision about the treatment for the patients, the doctors are in a dominant position and the patients are totally dependent upon the doctors for the treatment of their diseases. Now the critical analysis to be continued. As per the doctor, the Stewart Siegel, who is the renowned physician, he accepts that he had been dishonest with his patients sometimes during their treatments, which he really regrets, and also accepts that it affects the doctor-patient relationship trustfulness and also leads it into uncertainty. Now, the recommendations. The first thing to be noticed should be about training of the doctors of the ethical issues, as the emphasis on the practice of the ethical issues is not emphasized. They should pay close attention to the financial and the non-financial incentives, and also enhance the knowledge and skills of doctors and plans in doctor-patient relationship. The recommendations to be continued. They should focus on the doctor-patient relationship continuity. They should ensure the policies which threaten the individual care are corrected, and they should be noticed and should be corrected as an organization in a whole. And also the practitioners should be prudent in use of resources and not waste by providing the services of no benefits to the patients, like in the case of the terminally ill cancer patients, where after the many cycles of the chemotherapy, the doctors are also in a jeopardized situation that further treatment will be effective or not. So the patient's leftover life should be emphasized, and they should be allowed to spend more time with their family and the close ones. Now the next slide is about the discussion about the impact on the public health. The first point to be noticed is about the ethical issue, where the autonomy is violated by not giving the patient the full information. And also the second point is about the psychological harm by informing the patient with incomplete or the untruthful information, which puts the patient in the financial and the physical burden. On the next slide to be continued. It is about the professional issue, which is about hiding the truth, which is a breach of the professional ethics and creates uncertainty in trustful relationship between the patient and doctor, and puts the patient in the untruthful situation, and also affects their treatment. Now the next slide is about the question which I have formulated. It is about the 45-year-old man who comes for a treatment of advanced liver cancer. Now, should the doctor do the cycles of therapy or consider situation of the patient while informing the patient about the possible outcome and the treatment effectiveness? If yes, then what will be the benefits? If no, then your suggestions. Now the next slide is about the references. Thank you.